When insulin goes up, it releases a immune chemical messenger called interleukin 6. Interleukin 6 is an inflammatory cytokine. What this basically means is that when this insulin resistance is taking place, we are creating excessive inflammation in the body. Now, inflammation in the body is being perceived as the body as stress. So now what happens is the stress alarm goes off. The brain signals to the pituitary and sends a signal down to our adrenal glands that there's a lot of stress here. The adrenal glands now start to pump out cortisol. It is the stress release response to any kind of stress in the body. And so now this insulin resistant condition is triggering a stress response. Cortisol goes up. Well, guess what happens when you have elevated cortisol for too long? Cortisol increases insulin resistance. Cortisol causes more receptors to burn out. So you can see how you have a vicious cycle going on. Okay, let's go on to understand something else about this. Diabetes, as I said earlier, is a degenerative disease. With diabetes and almost all degenerative diseases, what we have is we have inflammation. Inflammation is taking place. If you're living with diabetes, you're living with inflammation. Okay? The medications are not really controlling the inflammation. They're controlling the blood sugar, but they're not controlling the inflammation. One of the largest concerns with diabetes is cardiovascular disease, right? If it's not checked, diabetes, eventually it leads to potential heart attacks or strokes. Very often, if you have diabetes, you might know that the capillaries, the ends of the arteries that transports the oxygen to the tissues, can deteriorate, and now you have an inability to get oxygen to the tissues. You also lose your sensory input, so you cannot feel anything. In fact, that's the number one sign of early or pre-diabetes, that a person will begin to actually lose their sensory input. I should kind of back up and tell you that the sensory is information going to the brain. So we get sensations from our taste, from touch, smell, sight, but we are sensory beings, and so we require a tremendous amount of sensory input, which means that the sensory component of our nervous system is extremely metabolically demanding, which means it requires a tremendous amount of glucose metabolism. So if we have insulin resistance, if we're pre-diabetic, and we are diabetic, and we have a fuel delivery problem, we're not getting energy into those cells, the very essence of our entire sensory system is going to be compromised. And we have a very difficult time of our awareness in the world. But what happens mostly is that we lose that sensation in our distal extremities first, especially our feet. That's why many people need to go to a podiatrist and have their nails taken care of, because if they get a cut or an infection, they won't even feel it. They don't know it's there, and it can progress. That's why many people who have diabetes, as it progresses, will actually get gangrene, and they will lose, or their toes will be amputated, or their legs will be amputated. Another degenerating change of diabetes is that it can affect eyesight, right? It'll destroy the retina of the eyes. Then it also causes the deterioration in the cardiovascular system, weakening the walls, leading to plaquing and poor coronary output and coronary stress and heart attacks and strokes. All the symptoms along the way of this particular thing obviously is tiredness, fatigue, forgetfulness, the list goes on. Anyway, let's just kind of move on a little bit here to talk to you about the two different approaches that you have when it comes to diabetes. In the traditional model, if you're not already doing this by now, it's just you run a blood test, the numbers go high. Once the number's high, you're given a drug and you're kind of sent on your way. And the only thing that's going to be managed is your lab number and regulating your drug. That is it. Now, it saddens me to say this, because so often I have patients come here and we run a blood test on them. They are on their medication, and their numbers will still come back well over 200. I said you 126 or higher is diabetes, and the numbers will come in at 225, 230, 250, and nothing's being done, you know, because the drug is just keeping it at that number. So obviously they're not getting really better. It's just slowing down, perhaps, the devastating effects. Right. In this office, we're not about treating lab numbers. What I do is to treat you. I treat you, the patient. We want to know what's driving the insulin resistance. What's at the root cause of why you have this inflammatory condition going on? It's not as simple as just saying, change your diet. Diet is important, there's no doubt about that, and changes are going to be necessary. We're not even telling you to come off your medication. If you're working with a physician at this particular time and he has you on metformin, perfectly fine. I'm not here to get you off the medication. I try and get you off the medication. I'm trying to get to the root causes of why you have this inflammatory process and help you change your life. Now, when we do work with patients, we do very comprehensive laboratory workups. Using functional medicine as our basic approach, we want to run lab tests. The first thing we're going to do is we're going to run a very comprehensive laboratory workup. We're going to look at a complete metabolic profile, lipid panels, CBCs with all the differentials. I know these things sound like a lot of different things to you, but a very, very comprehensive workup. When we look at your blood systems, we're not just looking at lab values if they're high or low. What we're looking at is to understand how the different systems of your body, your cardiovascular system, your digestive system, specifically your immune system, how these systems are functioning. Are they functioning properly, or is there an imbalance in how these systems are functioning? Because if there's an imbalance in these things need to be addressed. They need to be worked on. Remember when I talked to you before about inflammation right here? You have to understand, when we're dealing with inflammation, okay, there's many things that is driving inflammation. Number one is going to be stress. Now, stress comes in many forms, okay? It's not just the emotional stress, which of course is very important, okay? But we also have physical stress, and we have chemical stress. Chemical stress is unprecedented. We live in an extremely toxic world today. We have more toxic exposure than any time in history. We have more metals than any time in history. We pesticides our foods and genetically modify everything, air pollution, radiation. The point is there's a tremendous amount of chemical stresses that we're dealing with. All of this stress causes a stress response mechanism, as I mentioned earlier, which drives inflammation. Okay? We have things like, well, diabetes alone is a sugar problem, so sugar dysregulation. Cannot control. Blood sugar can be too high or too low. Okay? We can deal with dysregulation of the GI system, of your gut. This is extremely important. Digestive health is a major contributor to diabetes. The gut barrier is your frontline defense. It is your immune system. When that gut barrier is not healthy, it cannot keep out all of the bacteria and parasites and viruses and undigested foods and undigested proteins. Very often, many of these things begin to come reabsorbed back into the circulation, and they're perceived as toxins. And then we create an inflammatory response or an immune response against these particular toxins. That's the reason why we want to see if you have food sensitivities. Not the part of my handwriting, but food sensitivities. Many times we're acquiring food sensitivities because of dysregulated GIs. We eat foods, we don't digest them properly, they get reabsorbed back into circulation, and our immune system comes along and says, what is that? And it starts to create an immune system attack. So that leads to dysregulated, or let's just call it an overzealous immune system. So you can see how one thing can certainly affect another thing, but all of them collectively is still driving inflammation. And inflammation is at the root. It's at the heart of why you have the diabetes, because inflammation is what is driving the receptors of the cell, those insulin receptors, to burn out. So just